Welcome to my channel Medicine Guide. In the last video we have discussed the uses and side effects of doxycycline. In this video we will discuss the warnings and drug interactions of doxycycline. So let's start, but before that please subscribe to my channel Medicine Guide. Let's start with warnings. Warnings. You should not take doxycycline medicine if you are allergic to any tetracycline antibiotic. Children younger than 8 years old should use this medicine only in cases of severe or life-threatening conditions. This medicine can cause permanent yellowing or graying of the teeth in children. Using this medicine during pregnancy could harm the unborn baby or cause permanent tooth discoloration later in the baby's life. Before taking this medicine, you should not take this medicine if you are allergic to doxycycline or other tetracycline antibiotics such as demeclocycline, minocycline, tetracycline, or tigecycline. To make sure this medicine is safe for you, tell your doctor if you have ever had liver disease, kidney disease, asthma or sulfite allergy, increased pressure inside your skull, or if you also take isotretinoin, seizure medicine, or a blood thinner such as warfarin, Coumadin. If you are using this medicine to treat chlamydia, your doctor may test you to make sure you do not also have gonorrhea, another sexually transmitted disease. Taking this medicine during pregnancy may affect tooth and bone development in the unborn baby. Taking this antibiotic during the last half of pregnancy can cause permanent tooth discoloration later in the baby's life. Tell your doctor if you are pregnant or if you become pregnant while using this medicine. This antibiotic can make birth control pills less effective. Ask your doctor about using a non-hormonal birth control, condom, diaphragm with spermicide, to prevent pregnancy. This medicine can pass into breast milk and may affect bone and tooth development in a nursing infant. The extent of absorption is unknown. Do not breastfeed while you are taking this medicine. Children should not use this medicine. Doxycycline can cause permanent yellowing or graying of teeth in children younger than 8 years old. Children should use this antibiotic only in cases of severe or life-threatening conditions such as anthrax or Rocky Mountain spotted fever. The benefit of treating a serious condition may outweigh any risks to the child's tooth development. Doxycycline pregnancy warnings. AU. Tetracyclines are considered safe for use during the first 18 weeks of pregnancy, 16 weeks post-conception. Use should be avoided during the second and third trimesters of pregnancy. UK. Use of most oral formulations is contraindicated. Use of the 40 mg capsule formulation is contraindicated during the second and third trimesters. US. Use of the intravenous formulation is not recommended unless considered essential for patient welfare. Most oral formulations of this drug should not be used during pregnancy unless the benefit outweighs the risk. Use of the 40 mg capsule formulation is not recommended. Doxycycline breastfeeding warnings. LactMed. Short-term use is considered acceptable. As a precaution, theoretical, prolonged or repeat courses should be avoided throughout breastfeeding. Intravenous. The manufacturer makes no recommendation regarding use during lactation. Oral. According to some authorities and manufacturers, a decision should be made to discontinue breastfeeding or discontinue the drug, taking into account the importance of the drug to the mother. According to other authorities and manufacturers, use is contraindicated. Use of the 40 mg capsule formulation is not recommended. Excreted into human milk. Yes. How should I take doxycycline? Take this antibiotic exactly as prescribed by your doctor. Follow all directions on your prescription label. Do not take this medicine in larger or smaller amounts or for longer than recommended. Take tablets or capsules with a full glass of water. Drink plenty of liquids while you are taking this medicine. Most brands of this medicine may be taken with food or milk if they upset your stomach. Different brands of doxycycline may have different instructions about taking them with or without food. Take Oracea brand on an empty stomach, at least 1 hour. Before or 2 hours after a meal, you may open a regular capsule or break up a regular tablet and sprinkle the medicine into a spoonful of applesauce to make swallowing easier. Swallow right away without chewing. Do not save the mixture for later use. Drink a full glass, 8 ounces, of cool water right away to avoid the risk of esophageal irritation. You may need to split a regular doxycycline tablet to get the correct dose. Follow your doctor's instructions. Do not crush, break, or open a delayed release capsule or tablet. Swallow the pill whole. Measure liquid medicine with the dosing syringe provided or with a special dose measuring spoon or medicine cup. If you do not have a dose measuring device, ask your pharmacist for one. If you take this medicine to prevent malaria, start taking the medicine 1 or 2 days before entering an area where malaria is common. Continue taking the medicine every day during your stay and for at least 4 weeks after you leave the area. Use protective clothing, insect repellents, and mosquito netting around your bed to further prevent mosquito bites that could cause malaria. This antibiotic is given by injection only if you are unable to take the medicine by mouth. A healthcare provider will give you this injection as an infusion into a vein. Use this medicine for the full prescribed length of time. Your symptoms may improve before the infection is completely cleared. Skipping doses may also increase your risk of further infection that is resistant to antibiotics. Doxycycline will not treat viral infections such as the flu or a common cold. If you need surgery, tell the surgeon ahead of time that you are using this antibiotic. Store at room temperature away from moisture, heat, and light. Throw away any unused medicine after the expiration date on the label has passed. Using expired doxycycline can cause damage to your kidneys. What to avoid? Avoid exposure to sunlight or tanning beds. This medicine can make you more easily sunburned. Wear protective clothing and use sunscreen, SPF 30 or higher, when you are outdoors. Now have a look on drug interactions of doxycycline. There are some major drug interactions of doxycyclines with other drugs: cholera vaccine, live, digitoxin, isotretinoin, ketoconazole, mycophenolate mofetil, methoxyflurane, lamivudine, tretinoin, typhoid vaccine, live, vitamin A. How these drugs interact with doxycycline. We will discuss this in detail in the next video. That's enough for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer: channel's intention to make this video is for informational purposes only. Consult your doctor or healthcare provider for use of any medicine or for query of any disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guide. Up next, drug interactions of doxycycline in detail.